I am Professor Dr. Rafiq Khanani, President Infection Control Society, Pakistan. Today I would like to talk about and review the status of Pakistan over last 5 months of COVID epidemic in Pakistan. First cases of COVID were reported from Pakistan on February 26th, and initially these cases were coming from people who were traveling or coming back from other countries like Iran through the Afghan border, and there was a great gathering in Raiv in Punjab, where people from so many countries participated, hundreds and thousands of people participated, and some of them might be infected and they started infecting others. So the first phase of epidemic was noted, or the new cases was noted in those people who have traveled from abroad and or who were in direct contact with those people who were traveling from abroad. In the month of April, the local community acquired infections were reported and their number kept increasing tremendously over next 2 to 3 months. Still the month of June, third week of June, the number continuously kept increasing. From June 12th to June 20th, there was a peak of about 6,000 to 7,000 cases per day, new cases per day. From 20th June, the number of new cases started declining, and this reducing or declining trend continues as of today, which is 9th of August. Not only the new cases have started declining, but the people who are getting admissions in the hospitals for the seriousness of their condition or critical illness has also started declining significantly, and the morbidity has also reduced significantly. The maximum morbidity in one day was reported in the month of June at about 137 cases per day. But today there has been only 16 deaths reported. So there is almost 80% reduction in the number of new infections as well as the morbidity and mortality. Now this is the time when the government has decided to open up the lockdown from tomorrow, that is the 10th of August. Definitely the number of cases has declined significantly, and we are on a trend of recovering from the epidemic. But at this time, there is a very, very important message that we have to continue adopting the measures such as social distancing, using of hand hygiene, respiratory hygiene, and wearing of mask. Recent study published indicate that about 80% of the prevention is lies in the proper use of the face masks. So we have to continue practicing all those measures which are required to contain and maintain this lower prevalence of the disease. But at the same time, people are asking us the questions that what is the reason behind this reduction in the number of cases as well as reduction in morbidity and mortality. To the best of my knowledge, the most important factor that is favoring the reduction of the transmission of virus are environmental factors. Pakistan, in most of the country, we are having very hot weather, and this hot weather, along with the increased sunlight and ultraviolet rays in the sunlight, they are all responsible, as well as the winds that is flowing at a very, very high velocity. So these three factors are contributing to the reduction of transmission of COVID in Pakistan. In addition to this, of course, the people are getting more aware of the routes of transmission, so they are taking more precautions. There was lockdown, so huge gatherings were being banned and avoided, and most of the people started using the masks and proper hand hygiene. So all these factors have been responsible for cutting down the transmission of the virus. However, the virus has not gone out of the country and we have not got rid of the virus. So if we will we will keep maintaining all those standards which are required so that the virus transmission can be curbed and controlled. Perhaps we will be able to fight off the disease and reduce it to a very, very low level. The most important measures is we all know are of course the use of the proper masks, hand hygiene, respiratory habits, good respiratory habits, washing of hands, as well as sanitization of hands very frequently, and avoiding the close contact with anybody, particularly the distances of about 6 feet should be maintained most of the time or all the time. And we have to avoid all the unnecessary gatherings or travelings so that the new cases can be controlled. Another important thing about reduction in the morbidity and mortality that we have learned so much about how to manage the cases. Moreover, the resources that were not available at the beginning of the epidemic are now available, including the medications. Newer medications are available, newer strategies are available, equipment is available to maintain and manage these patients. A more number of beds and facilities are available. So we have learned to to manage the cases, and this learning has improved over last few weeks or few months. Moreover, the number of serious cases that are coming to the hospital was much higher earlier, and the cases used to report to the hospital very late. Nowadays, we are getting the cases at an early stage, so they are managed properly, and that's why there is a significant reduction in the mortality as well. I hope that the nation will continue after the lockdown all those measures that are required so that the epidemic can be maintained under control and it can be reduced further so that the normalcy in the life can be returned to normal. Particularly, I would like to emphasize on the bigger corporations and organizations where hundreds and thousands of people are working. So they must adopt the measures which are very, very important so that the disease does not spread when people are working in their own industrial environment or other environments, business environment, and they have to keep a good eye and monitor them so that all those people who are either suspected of being infected are tested properly, traced back, and all the contacts are traced so that only those people who are infected can be put under lockdown, and those people who are not infected, they can continue enjoying normal life, keep working normal life, and be productive in the society. So I hope that this trend will continue, and we, and particularly all our leaders and the industrialists, will take all those measures to identify those who are infected earlier, track them down, and isolate them, and treat them whenever they are required at an early stage to prevent the spread of the virus. These measures not only will decrease the number of people infected from COVID, but they will have a better health indices, and all other diseases which are particularly of infectious nature can be controlled and reduced, and that will improve the efficiency of the and the functioning of the organizations. So I hope that Infection Control Society Pakistan has been offering all the kind of help and support to the industries and whatever segments of the society they require. And we are also trying to educate the masses. And I hope that people will learn from these educational activities and adopt it in their life. So it's hoped that Pakistan will soon be a country which may aspire to become a COVID-free country. Thank you.